They told you Ebola was gone. They were wrong. And what is happening right now is something that should immediately grab your attention, even if you think this has nothing to do with you. Because today, we are not talking about fear for the sake of fear. We are talking about a real outbreak, real numbers, and real scientific warnings that are being spoken about far less than they should be. Right now, the World Health Organization has declared a global health emergency due to a new Ebola outbreak. At least 134 people are already reported dead, and the virus is no longer staying in one place. It is crossing borders. It is moving in ways that remind experts how quickly global health situations can shift when early signals are ignored or delayed. And here's the part that most people do not realize until it is too late. There is no widely available, fully approved vaccine for this specific strain. That means protection is not simple, and it is not guaranteed by existing tools that many assume are already in place. This is not a theoretical concern. It is an active gap in our current medical defenses. Now, if you are over 60, this becomes even more important because your immune system is not the same as it was at 30 or 40. This is not about fear, it is about biology. As we age, our immune response naturally weakens, and this changes how the body handles new and aggressive infections like viral hemorrhagic fevers. You might think Ebola is something far away, something that only affects certain regions of Africa and has nothing to do with daily life elsewhere. That same belief was common in 2014, right before cases appeared in the United States and created widespread panic. Distance does not always protect us in a connected world. Research published in The Lancet after that outbreak showed something very important. People over 65 had mortality rates nearly 3 times higher than younger adults when exposed to similar viral hemorrhagic infections. The reason is tied to a process called immunosenescence, which is the gradual weakening of the immune system that begins around age 50 and accelerates significantly after 70. In simple terms, your immune system changes with age. The defense system that once reacted quickly and efficiently becomes slower, less coordinated, and less responsive. It is like an army that has fewer soldiers, less communication, and slower reaction times. Against a fast moving virus, that difference matters greatly. And this is exactly why understanding what is happening now is so important. I am going to walk you through what Ebola is doing inside the body, why older adults face higher risks, and what science based steps can actually help strengthen your natural defenses. But before we go there, it is important to understand the scale of what we are dealing with. This outbreak has already triggered an international health emergency designation. That is the same level of alert that was used during major global outbreaks in recent history, which tells you how seriously health authorities are treating it behind the scenes. So the goal here is not panic. The goal is awareness with clarity. Because once you understand how the virus works and how the aging immune system responds, the next steps begin to make practical sense. Now let's go deeper into what is actually happening right now, how authorities are responding, and why the scientific community is paying close attention to this specific strain. This current outbreak is not being treated as routine by global health authorities. The World Health Organization has officially classified it as a public health emergency of international concern. That is not a casual label. It is a formal escalation used when a disease has the potential to spread beyond its original region and create cross border health risks that require coordinated global response. At the same time, there is something important that most people are not being told clearly. This outbreak involves a variant strain of the Sudan Ebola virus. That matters because it is not identical to the Zaire strain that most existing vaccine research has focused on. In other words, the scientific tools we often associate with Ebola prevention were largely developed for a different version of the virus. Researchers at institutions like the Institut Pasteur in Paris have pointed out that cross protection between Ebola strains is still not fully understood. In some cases, it may provide partial defense. In other cases, it may offer very little or no meaningful protection, depending on the immune profile of the individual. That uncertainty is exactly what makes public health officials cautious and why emergency classifications are used early rather than late. Now, before we go deeper into strategies and protective steps, I want you to be part of this conversation for a moment. Think about your own situation or someone close to you. How old are you, and have you ever lived through a serious health crisis like a pandemic or a major outbreak? The reason I ask is simple. Experience changes how we understand risk. And I read these stories because they help connect science to real human lives. What we are going to do next is break everything down into 5 practical strategies. These are not based on speculation or fear based thinking. They are structured around research in immunology, aging, and public health science. The goal is to move from confusion to clarity. We start with number 5, and it may sound simple, but it is often ignored. The first strategy is understanding the threat before reacting to it emotionally. Knowledge is not just information here, it is protection. One of the biggest problems during outbreaks is misinformation and incomplete understanding. When people do not understand what is happening, fear fills the gap, and fear often leads to poor decisions. What makes the situation more complex is the nature of the virus itself. We are dealing with a variant strain of Ebola, which means the immune system's previous reference points, so to speak, may not respond in the same way they would to earlier strains. This is why scientists emphasize caution rather than assumptions of existing immunity or vaccine coverage. The emergency declaration by the WHO is not just about current case numbers. It is also about potential trajectory. In global health, timing is critical. Once a virus crosses regions and adapts to travel patterns, especially in a world connected by international flights, containment becomes significantly more complex. This is something we learned very clearly in past outbreaks. What begins in localized regions can, within days, become an international concern. Not because the virus changes instantly everywhere, but because human movement does. So the first protective layer is not medical intervention, it is awareness. Knowing what is confirmed, what is uncertain, and what is still being studied allows you to filter information properly and avoid both panic and misinformation. Now, with that foundation in place, we can start moving into what the virus actually does inside the human body and why that biological process matters, especially for older adults. That is where things become even more important to understand. To understand why the situation is being taken so seriously, we need to go inside the body and look at what Ebola actually does at a biological level, because the danger is not just in infection itself, but in how the body responds to it. Ebola is a single stranded RNA virus, which means it carries genetic material that allows it to rapidly hijack human cells. Once it enters the body, it behaves like a biological intruder that breaks into cells, takes control of their internal machinery, and forces them to produce thousands of new copies of the virus. Instead of the body controlling the process, the virus turns the body into its own replication system. At first, the immune system detects this invasion and responds aggressively, but in severe cases, this response becomes overwhelming. Scientists describe this as a cytokine storm, which is an extreme inflammatory reaction where the immune system releases large amounts of signaling molecules all at once. Instead of targeting only the virus, this reaction begins to damage the body's own tissues. Blood vessels can become more permeable, meaning they start to leak. Organs begin to struggle under the pressure of inflammation. The balance that normally keeps the body stable begins to collapse. And importantly, in many severe Ebola cases, the virus is not the only cause of damage. A significant portion of the harm comes from the body's own overreaction. This is where aging becomes extremely relevant. As we get older, the immune system does not respond in the same balanced way it once did. Researchers at institutions like the University of California, San Francisco describe this as a dual dysfunction. On one hand, the immune system becomes weaker at identifying and responding to new threats. On the other hand, it becomes more prone to chronic low level inflammation. This persistent background inflammation is often referred to as inflammaging. It means the immune system is not fully calm, but it is also not fully effective. It exists in a constant state of partial activation, which over time creates stress on the body's systems. When a fast moving virus like Ebola enters this environment, the response can become unstable. The immune system may not react quickly enough in the early stages and then overcompensate later with excessive inflammation. That imbalance is one of the key reasons older adults are considered at higher risk for severe outcomes in viral infections. Scientific data supports this concern. A 2023 review published in Nature Aging found that older individuals with higher baseline inflammatory markers, such as elevated C reactive protein, had significantly higher mortality risks when exposed to new viral infections. The difference ranged from 40 to 60% compared to peers with lower inflammation levels. This does not mean outcome is predetermined. It means baseline health matters. The state of your immune system before exposure plays a major role in how your body handles stress, infection, and recovery. So, when we talk about Ebola or any severe viral outbreak, we are not only talking about the virus itself. We are also talking about the internal environment of the human body, especially in older adults where immune regulation is already under strain. This is why scientists emphasize both prevention and immune resilience. Because once the body enters a state of uncontrolled inflammation, the damage becomes significantly harder to manage. Now that we understand what is happening inside the body, the next step is to look at what practical, science based actions can help support immune stability, especially in older adults who are most affected by these changes. One of the most overlooked factors is nutrition, especially in older adults, because food is not just energy, it is biochemical input that directly shapes immune behavior. During outbreaks, the body is under stress, and that stress is either supported or worsened by daily dietary choices. Let me give you a real example. A patient I will call Margaret was 72 years old and living in Scottsdale, Arizona. She came in during the early phase of a previous viral outbreak after recovering from a serious infection. Even though she had technically recovered, she did not feel recovered at all. She was exhausted, mentally foggy, and deeply worried that her immune system had been permanently weakened. When we ran her lab work, the pattern was very clear. Her inflammatory markers were significantly elevated, her vitamin D levels were low, and her diet, which she thought was normal, was heavily loaded with processed foods, refined sugars, and industrial seed oils. These are the types of foods that do not necessarily cause immediate symptoms, but they steadily increase internal inflammation over time. What we often see in cases like this is not a single cause, but a combination of small daily stressors that gradually push the immune system into a less stable state. The body becomes more inflamed, less responsive, and less efficient at regulating immune activity. Over a period of 6 months, we focused on structured nutritional changes rather than extreme restrictions. The goal was not perfection, but consistency. When she returned for follow up testing, the results were striking. Her C reactive protein, which is a key marker of inflammation, had dropped by more than half. Her immune cell activity, especially the cells responsible for identifying virus infected cells, had improved significantly. More importantly, she described feeling like she had regained control of her own body again. This is not an isolated case, it aligns with broader scientific research. Studies from institutions such as Harvard's Chan School of Public Health have shown that diets high in refined sugars and processed fats can suppress neutrophil function, which are one of the body's first responders in immune defense. Even short term exposure to poor dietary patterns can reduce immune efficiency. On the other hand, dietary patterns like the Mediterranean style diet have been repeatedly associated with lower levels of systemic inflammation and improved immune function, especially in older adults. These diets emphasize natural fats, vegetables, lean proteins, and fermented foods that support the gut microbiome. And the gut microbiome is not a secondary detail. Roughly 70% of the immune system is linked to gut function. As we age, diversity in gut bacteria tends to decline, which can reduce the body's ability to respond quickly and appropriately to new pathogens. This is one of the reasons older adults often experience slower or less coordinated immune responses. So, in practical terms, during a viral outbreak, the focus is not on extreme diets or sudden changes, but on reducing inflammatory load. That means limiting refined sugar, reducing heavily processed foods, and prioritizing whole, nutrient dense meals that support immune regulation. At the same time, increasing intake of foods rich in healthy fats, fiber, and natural antioxidants can help stabilize immune responses. These changes do not act like medicine in the traditional sense, but they influence the internal environment that the immune system operates in every day. And that internal environment matters more than most people realize, especially when the body is already under pressure from age related immune changes. Now that nutrition and inflammation are understood, the next critical factor is something most people underestimate entirely, yet it has one of the strongest direct impacts on immune function. Sleep and circadian rhythm regulation, especially in older adults. Insufficient sleep is not just about feeling tired the next day. At a biological level, it is a form of immune dysfunction. When sleep is consistently shortened or fragmented, the body loses its ability to properly regulate immune responses, and that becomes especially dangerous during viral threats. This is even more important in older adults because sleep quality naturally changes with age. Many people over 60 notice they fall asleep earlier, wake up more often during the night, or struggle to reach deep, restorative sleep. What they may not realize is that these changes directly affect immune performance. Research published in the journal Sleep by the University of Pittsburgh School of Medicine found that adults over 60 who slept fewer than 6 hours per night had natural killer cell activity reduced by nearly half compared to those who slept 7 to 8 hours. Natural killer cells are critical because they are among the body's first line of defense against virus infected cells. To understand why this happens, we need to look at what sleep actually does. Deep sleep stages are when the immune system undergoes most of its repair and recalibration. During this time, the body produces and regulates immune cells, balances inflammation, and restores immune readiness. Without enough deep sleep, this process becomes incomplete. As people age, several biological changes interfere with this system. The brain's internal clock becomes less sensitive to light cues, which disrupts melatonin production. Melatonin is not just a sleep hormone, it also plays a role in immune regulation. At the same time, the structure of sleep itself changes, with less time spent in deep sleep stages where immune recovery is most active. There is also a neurological factor. The suprachiasmatic nucleus, which is the part of the brain that controls circadian rhythm, becomes less responsive with age. This leads to weaker signals for sleep timing, which is why many older adults experience irregular sleep patterns. A practical example helps illustrate this clearly. A patient named Harold, 78 years old from Portland, came in with frequent respiratory infections. Despite having a decent diet and staying active, he was consistently sleeping poorly. He would fall asleep in front of the television, wake up in the middle of the night, and rarely get more than 5 hours of rest. When we focused on correcting his sleep patterns rather than adding medications or supplements, the change was significant. Within a couple of months, his infection frequency dropped dramatically and his overall energy improved. He described it as feeling like he had regained years of his life. This is why sleep is not a passive process. It is an active immune function, and improving it requires structure. Simple changes can make a major difference. Exposure to natural daylight in the morning helps reset the internal clock. Keeping a consistent sleep schedule stabilizes circadian rhythm. Reducing screen exposure before bed supports natural melatonin production. Lowering room temperature helps the body enter deeper sleep stages more efficiently. In some cases, low dose melatonin can be used carefully under medical guidance, along with nutrients like magnesium that support nervous system relaxation and sleep quality. The key idea is consistency. The immune system does not benefit from occasional good sleep. It benefits from repeated stable cycles that allow full recovery night after night. And when sleep is stabilized, the immune system becomes significantly more resilient, especially in older adults facing viral challenges. Now that we understand sleep and circadian rhythm, the next step is to look at physical activity, specifically a very precise type of exercise that has been shown to improve immune regulation without overstressing the body, even in older populations.